Okay, I believe it's time that we start already our webinar for today. A pleasant day to everyone, and welcome to the 25th episode of Tuesdays with MEFIN. We have a very interesting topic for today, which is promoting telemedicine in the Philippines against COVID-19. Not only is it interesting, but it's very, very timely given the situation. I'm Ronnie Limbago. I'm your moderator for today. And to start the show rolling, I would like to call on our new program director for RFPI Asia 3, Dr. Volker Steigerwald. Dr. Steigerwald, please.
Yeah, thank you, Ronnie. Yes, my name is Volker Steigerwald. The regulars of this webinar, Tuesdays for MEFIN, will wonder, who is that guy with a difficult name? Well, just call me Volker. 1st March of 2021, I have taken over the directorship of the GIZ-supported RFPI program from Antonis Malagardis. GIZ RFPI, a regional program funded by the German Federal Ministry for Economic Cooperation and Development, the BMZ, for the promotion of climate and disaster risk insurance, CDRI. Many of you know Antonis. He has developed and run even the predecessor of RFPI, the MIPS, and then the RFPI for many years, and led it to high visibility and success. I thank Antonis for really doing a good job here. RFPI has a great team, which is now my team. I am an economist with a PhD in agricultural economics, a long timer with GIZ and earlier GTZ even. I had my first assignment with GTZ in 1980 in Sumatra, Indonesia. So you might guess my age now. As for now, I'm working out of Germany from my home office, which is in Hanau, close to Frankfurt, in the state of Hesse. It is 9 o'clock in the morning over here. The sun is shining. We have bright blue skies. So from here, good morning, good afternoon to Philippines and Asia. It's my pleasure to welcome the speakers and participants of this 25th episode of Tuesdays with MEFIN, Mutual Exchange Forum on Inclusive Insurance Network. The Tuesdays with MEFIN is a webinar series of various topics of interest in the insurance to the insurance regulators and insurance industry players in all 7 countries: Indonesia, Pakistan, Philippines, Nepal, Mongolia, Sri Lanka, and Vietnam, which compose the MEFIN network. RFPI is the secretariat of the network. The topic of this webinar today is on promotion of telemedicine, which is very timely as we are in the midst of COVID-19 pandemic. Also in Germany, we are now experiencing the 3rd wave. Today's webinar is jointly organized by the GIZ, MEFIN, and the CHMF, Cooperative Health Maintenance Federation, or also called One Coop Health. The One Coop Health is a cooperation partner of GIZ in the implementation of a public-private partnership project on promoting telemedicine against COVID-19. We are very much honored to have 4 speakers with us today who will share their respective experiences in the promotion of telemedicine practice from the points of view of government policies, regulation, business, and research and development. We have Dr. Portia Fernandez Marcelo, Professor, Department of Family and Community Medicine, College of Medicine, from the Philippine General Hospital and University of the Philippines, Manila. We have Mr. Jen Gilbert S. Yanto, Chairperson of the CHMF, One Cooperative Health. We have Ms. Alfie Paulino, Sales Manager of Global Telehealth Incorporated. And last but not least, Ms. Hufsa Munawar, expert on telemedicine advocacy strategy. Ronnie is moderating the whole session, and he will also formally introduce the speakers and the flow of the webinar. I'm happy actually to see the majority of our speakers today are women. As you probably know, GIZ is an advocate on gender development. Once again, warmest welcome to our speakers and participants. I'm looking forward to a productive webinar. Maraming salamat po. Thank you very much. Vielen Dank.
Thank you very much, Volker, for such an inspiring welcome remark. And Shine, could you show the slide again, please? Shine?
Yes, Sir Ronnie.
I cannot see the slides.
I'm showing the guidelines.
Yeah, oops.
Third slide.
Uh-oh, I think I'm experiencing some technical glitch. Well, anyway.
No slides too.
Just for a moment, ladies and gentlemen, I'm experiencing some glitch.
Ronnie, shall I take over?
There, now I see it. Thank you very much, Shine. Sorry for the glitch, ladies and gentlemen. As I mentioned earlier, we do have quite a lot of ground to cover, so I'll just run through the guidance and later on be introducing you to the panelists for our webinar today. Our guidelines are basically simple house rules. First of all, we'd appreciate it if you turn off the microphone and the webcam in order to conserve internet bandwidth and to allow for an uninterrupted webinar. Okay. If you have questions, then just please post them in the chat. There's a chat box provided there, and we will pick them up during the Q&A session. The slides will be shared after the event email and in the MEFIN Facebook group. Next slide, Shine. Okay, this is the agenda for today. We have gone through the welcome remarks and we're right now in the guidance. After the guidance, actually, will be the beef or the main portion of this webinar, which is the panel discussions. And actually, we have 5 interesting topics that we will be sharing to you, and this will be discussed by the panelists, which were earlier mentioned by Volker. The first topic will be government policies and programs on telemedicine as a response, including to COVID-19. The landscape of the telemedicine industry in the Philippines, lessons in promoting telemedicine with cooperatives, business case in telemedicine practice, and finally, challenges and lessons in telemedicine communication strategies. This will be from 3:05 to 3:40. Okay, and after that, we will be having an open forum for the questions that were sent. And finally, at before 4 o'clock, we will be having the wrap-up. Actually, the wrap-up will be an evaluation survey to see how well this telemedicine has met your expectations. This telemedicine webinar has met your expectations. Okay. Next slide, Shine. And now to introduce our panelists. And the first panelist is our, excuse me, Dr. Portia Fernandez Marcelo, and she will be discussing the topics on government policies and programs on telemedicine as a response, including COVID-19, and the landscape of the telemedicine industry in the Philippines. Dr. Marcelo is a professor of the College of Medicine in the Philippine General Hospital and the University of the Philippines in Manila in community medicine and health policy. Prior to that, she was the immediate past director of the National Telehealth Center, National Institute of Health. She is responsible for developing cost-effective tools and innovations in the realm of information and communications technology for improving healthcare. As one of the pioneers of telehealth in the Philippines, Dr. Marcelo is a much sought-after expert, and her work has greatly contributed to the current framework of telehealth in the country, such as the advocacy for telehealth house bills, Department of Health administrative orders, and presidential executive orders on telehealth from 2011 to 2016. She was likewise very much involved in the AHEAD HSPR Health Systems Policies research of the Department of Health, the Department of Science and Technology, and the Philippine Center for Health Research and Development from November 2019 to September 2020. To date, and given her advocacy on telehealth, Dr. Marcelo is the principal investigator or the project leader of eHealth/Digital Health Innovations funded by DOH, the Department of Science and Technology, the Commission on Higher Education, and UNICEF for programs such as National Telehealth Service Program, the RX Box, RCHITS, Mag-ina, which in English is Mother and Child Telereferral System, Medical Teleparasitology, I hope I got that right, Hearing for Life, and also serves as a consultant on public health for both local and international organizations, such as the mentioned DOH, the World Health Organization, with GIZ, the IDRC of Canada, USAID, and various local government units. Dr. Marcelo, kindly greet our participants.
Yes. Good afternoon, everybody.
Oh, that's a very short greeting. Thank you very much, Dr. Marcelo. Anyway, you'll be hearing much from Dr. Marcelo later on. Our next panelist, who will be sharing his insights on the topic lessons in promoting telemedicine with cooperatives, is retired Major General Gilbert Sanchez Llanto. He co-founded in October 1981 the ACES Credit Cooperative Development Inc., or the ACCDI, the forerunner of the ACDI Multipurpose Cooperative, and currently serves as the incumbent chairperson of the board of directors of the ACDI Multipurpose Cooperative. He previously held general management positions in the cooperative as a former president and assistant general manager. Major General Llanto is also the chairperson of the Cooperative Health Management Federation, or the One Co-op Health, a cooperative HMO group based in Quezon City, and the vice chairperson of the Climbs Life and General Insurance Cooperative based in Cagayan de Oro City. Prior to his foray in the cooperative sector, Major General Llanto served with the Philippine Air Force for more than 35 years, thus bringing his discipline and determination, which led to his success in the private sector. General Llanto, some words from you, please.
Hi.
General?
Yes.
You said hi.
Glad to be here in our webinar.
Thank you very much, sir. And so are we. Our third panelist is Ms. Alfie Paulino, and she's to discuss the business case in telemedicine practice. Ms. Alfie, who is the sales manager of Global Telehealth Inc., handling both enterprise and government accounts nationwide. She is part of the pioneer team of Consulta MD and took part on projects initiated and participated but not limited to the development of teleconsultation services in 80 barangays in the Calabar Zone, Department of Health COVID-19 Hotline Sandbox Project, and OWA's teleconsultation service for returning OFWs in quarantine areas. She works directly with corporate clients to design service programs that best fit their client needs. She is likewise an entrepreneur and a graduate of BS Physical Therapy. Prior to joining GTI Consulta MD, she worked in the BPO industry as operations manager for 16 years. Miss Alfie, some words from you too, please.
Yes, good afternoon. Thank you for inviting me in this webinar. It's a privilege to be part of this one.
Thank you, Miss Alfie, and the pleasure is also ours. And finally, last but not the least, we have Miss Hufsa Munawar. She will share with us her experiences on challenges and lessons in telemedicine communication strategies. She's our expert from Pakistan, actually. Hufsa is a digital marketer by passion and profession, and she has been working in the field of digital communications for the past 8 years, with her experience focusing on tech ecosystem of both the Netherlands and Pakistan. She completed her studies from the Netherlands and returned to Pakistan with the aim of contributing to the digital world her learnings. For the last 3 years, Hufsa has worked with the health tech industry, aiming to launch and promote the use of telemedicine in developing countries. Ms. Hufsa, some words also from you, please.
Hello, everyone. Thank you for the introduction and thank you for inviting me. I'm really looking forward to the discussion that we have here.
And thank you very much, and we're also glad that you are here. So we are very fortunate to have all these experts with us today, and we know that all of them will be providing you with valuable information and insights on telehealth in the Philippines. And with this, we now proceed to the panel discussions. Just some additional guidelines. For each topic, our panelists will have 7 to 7.5 minutes to discuss, given our time limits. There will be some slides to accompany the discussions in order to provide you with a better idea on what our panelists are discussing. Okay. You are most free to send in your questions via chat. And again, given our time limitations, these questions will be answered during the open forum. So now we move to the panel discussions, and the very first panelist is Dr. Portia Marcelo. Okay. Dr. Marcelo will be discussing, as I mentioned, 2 topics with us, and so we will be having 2 questions for her. Okay, Dr. Marcelo, the first question is in relation to the programs and policies are, what are the policies and programs in place in the Philippines to promote telemedicine as a response, including the fight against COVID-19? And the second question, which is on the landscape of telehealth, telemedicine, given the existing policies, programs, and developments in telemedicine field, how would you best describe its current landscape or situation? Dr. Marcelo, you now have the floor.
Hello, good afternoon, everybody. I prepared a few slides. I hope Shaitan can show the first one. Thank you. Okay, so this is me. I was introduced at length. Thank you very much. Next, please. And so this slide is a little busy, but there are perhaps 3 messages. Majority of you are Filipinos, and let me affirm that our system, our health system, is both public and private. My work is essentially working with the public sector as a scholar ng bayan or somebody who graduated and is working for the state university. I feel that a lot of our innovation should benefit first and foremost our people in the peripheries, in what is called the isolated and disadvantaged areas. That's why a lot of our work is around that. And when you talk about telehealth or e-health policy or telemedicine policy in the Philippines, so you're seeing here that our campaign, our implementations has led into the development of local policies. So I have 2 examples here, which were penned in 2013 and 2016 in Nueva Ecija as well as Leyte. So there's a local government, Sangguniang Bayan, or local municipal council resolution. By that time, the updated PhilHealth law in 2012 was passed, and it enshrined the word telemedicine or telehealth as something that the National Health Insurance Program should pay for in order to um, increase the benefits for members of PhilHealth. At the national government level, the executive level, definitely telehealth and telemedicine and e-health was more distinctly written in the Department of Health National Objectives for Health, as well as the Department of Science and Technology Unified Health Research Agenda. So very important is the push of science and technology because in the end, telemedicine and telehealth at that time in this a decade ago was really just in the realm of innovations and research. Nevertheless, our output actually contributed now to what has been developed as a draft. Nevertheless, a presidential executive order and a DOH administrative order on telemedicine or on telehealth, the National Telehealth Service Program. This coincided actually with the research we were doing with UNICEF, the art sheets, where we were demonstrating an electronic medical record system as well as a telereferral system seamlessly connected for isolated and disadvantaged communities. And that's why a presidential executive order, albeit a draft, was actually uh, made. And the campaign, actually, while we began at the university campaigning for legislation way back in 2009, it was only in 2012 that a bill was actually passed. A bill was actually filed by Congressman Abaya. And I'd like you to note that it was about a national telehealth system. So the focus was on telehealth. And the idea there was really to increase access to better care. 10 years ago, the health system was poorly resourced, and it was only in the last decade that more investments in healthcare was actually made. So at that time, really, what we wanted to escalate was really better access to better care. And the year after, or in 2014, I meant, another bill was actually filed in the next Congress by a physician who is also a congressman, uh, uh, sorry, Rogelio Espina here. And it was passed on first reading at the Committee on Health by 2015. Next slide, please. The next slide will actually show that it still remained at the realm of um, at the legislative level. However, now it expanded to e-health. So it's not just about telemedicine, but it also covered healthcare, not within a distance, but even in electronic medical records. The discussion then was that we cannot just focus on just telehealth services alone, but there should be a more enabling or more encompassing bill, and that's why it was proposed this way. Then fast forward, by 2017, a Senate bill was actually filed by Senator Ejercito, who headed the committee, the Senate Committee on Health. And it continued on, this time taking on the flavor of what would be legislated as the Universal Healthcare Law. And so it was really talking about e-health systems and services. But recently, if you note, the most recent filing of the House bill put back the word telemedicine. So now it's an e-health and telemedicine development act. But it also coincided precisely with the campaign for universal health care. And this is where social health insurance is actually very, very important. What is actually in place is this DOH National Privacy Commission Joint Memorandum Circular, which was dated March actually of 2020. And it is about the use of telemedicine in the COVID response. And in more detail, the UP College of Medicine Medical Informatics Unit brought out a guidance for physicians on their use of telemedicine. So you can see, so from a macro view of telehealth and e-health, This was focusing more on telemedicine. The inspiration then was precisely the lack of access, uh, the lack of access of doctors to of patients to the regular healthcare, and it was also in the light of the quarantine where we wanted the people to stay at home. So certainly, actually, the what the DOH did was a sandbox, trying to study how the behavior and how telemedicine can actually be eventually incorporated. And they actually saw beyond COVID, there were other clinical cases that were actually being discussed and managed. Okay. So, which is now my segue to the next slide. Next slide, please. So just to clarify, so telehealth and telemedicine is somewhat used interchangeably. Just to emphasize that telemedicine talks about cure. So both, however, is telecare. So telehealth is about preventive, promotive, curative, a healthcare delivered over a distance. E-health is not just only over a distance. Okay. Next slide, please. Umarna. Hello.
Dr. Pesha, hold on lang po. I lost my, someone is sharing their screen. I lost my,
Yes. Next slide, please. Oh. Yeah, so now I'll present to you the landscape of telemedicine implementations in the Philippines. This was born out of our research. It began pre-pandemic in 2019. Oh, hello? Sige, Shine, are you fixing? Yeah. So next slide. Oo. So I wanted to emphasize the importance of this universal healthcare law. So that's Republic Act number 11223, enacted by Congress and Senate in 2019. And in this slide talks about important principles enshrined in the law, universality meaning reaching all Filipinos, and equity, which is really the motivation why the University of the Philippines embarked on telehealth way back in 2004. And definitely accountability, not only but especially by the health system. And it's a rejection of this current practice still of referring to the hospital of choice, giving back to the patient that it's their role now, it's their responsibility for them to transfer to the hospital or whatever clinic, because you cannot the health sector cannot take care of you, and it's your responsibility. Just take care of yourself, look for someone. So the universal healthcare law has that promise that the health sector is accountable for your care. So, and this is important in terms of telehealth. And the health the UHC UHC law, universal healthcare law, will try to organize in the near future what are healthcare provider networks, which is depicted by the next slide. Okay, so this comes from the OH. Next slide, please, Shine. So here, so in this case, you can see that there will be primary care provider networks. All Filipinos will be assigned to a primary care provider, and if there is necessity for you to be transferred to upper level cares, you will also likewise be organized in that system. And even the financing will also be organized in this system. I'm losing my slide again. Miss Bagalawis, are you sharing your slide or Shine? Uh-oh. Hello?
that's not my time.
Mm-mm.
Someone is sharing your screen.
Yes. Uh-oh. Hello?
To our participants, please don't try to share your slides. It affects the presentation, please.
So I need you to understand that the law talks about that there will be significant health sector reform in the sense that we will eventually be reorganizing the healthcare system, not only in terms of the idea of a national and the local health system, a public and private sector, but they will really be the system will really be organized such that each Filipino will be assigned a primary care provider. And the usual cases should be taken care of by your primary care provider, including X-rays, the typical conditions that can be managed outside of the hospital. And then only when you need hospital care and very specialist type of care, that's when you get to be referred to your specialist. And in a way, people need to understand that. A good example is this COVID One Command Center, where if you go to your local hospital and then you need hospitalization and it's full, this one command center can actually redirect you to the facility where you will be cared for in the nearest place, and you will be cared for because they are better equipped. So how I wish that happened, 30 years ago when I was still a young doctor. But nevertheless, the campaign for, universal healthcare continues, and we are hopeful for this law. Okay, next slide, please. So in our paper for the Department of Health and the DOST, what they were looking for was what types of telehealth solutions, and what we actually needed to implement the law in its entirety. It's not only directed towards improve patient clinical outcomes, which is in healthcare delivery. We also see telehealth to be useful in professional competence, like this webinar. It's meant for there are a lot of teleconferences that can equip your health professionals, not only doctors, nurses, so that they can care for you in the best possible way without having to import them to Manila or elsewhere. So we want to maximize that one. And for instance, our work in the National Telehealth Service Program, we've been providing mentoring, some form of PGH clinical specialists. We're supporting doctors with the barrios in the peripheries, in the rural remote communities, in their clinical dilemma. So that's a form of telementoring and professional support. It was only in this COVID-19 that a lot of teleconsultations was increased in number. So this is where patients are directly talking with their physicians. However, another form of telecare is public and patient education. For instance, a lot of you are non-clinicians, and in a way, we're orienting you what telehealth and telemedicine is. And sometimes we're also, definitely what you see on TV, this is a form of telemedicine. Dr. Willie Ong is particularly popular on YouTube, and that's a form of public and patient education, and it's a form of telehealth. Next slide, please. Next slide, yes. So just to show you that we've pioneered this, and when we use this typology, a lot of our work is really in the among the same, or in the health sector. So it's more on professional support, and we only have 2 of our projects that was in a healthcare delivery system, meaning the system is quite organized, where the primary care physicians, primary care facilities are organized or linked with other higher level facilities. So this is the Mag-ina telereferral system, or the maternal and infant and neonatal telereferral system, and the newborn hearing screening program. So we have a form of telereferral here, or teletriage. Next slide, please. So what we did in this paper also, we studied, we had a scoping study of the types of telehealth programs in healthcare delivery systems, and this is what we found. I want you to focus on the gray dots, and these are the Philippine implementations. They're more on teleconsultation, not much on health in an organized system, and a lot on public and patient education. However, this paper is actually limited in that we did not look, is limited in that the data collection ended in May 2020. And we did not search for HMO as a term then, but practically all the major HMO is using all the major HMO organizations are now using telemedicine at this point, 1 year after our paper, and all the major hospitals are actually offering telemedicine as well. I also want to share that we actually found, so up to May 2020, we actually found about 95 telemedicine service providers. And however, only 19 later on uh, participated in our survey, and among all of them, uh, a majority, or up to 58% or 53%, or 10 of them, are actually in the private sector. And the their experts are clinical specialists, patients are their telepresenters, and only two of them said that they have patients or clients up to more than 10,000. So it, in a way, it indicates perhaps a maturity of their service. There are other details, but I will be happy to share them with you when you ask questions at the Q&A. So thank you very much.
Okay. Thank you very much, Dr. Marcelo. That was very interesting. And Shine, could we now move to the next slide, please? So now we have our second panelist, retired Major General Gilbert Eslianto. And the question for you, sir, is as an organization committed to promoting the use of telemedicine, especially for the grassroots sector, can you share with us your experiences and the key lessons which should be considered to further advance meaning telemedicine, as a viable option for effective healthcare delivery? General Llanto, please.
Thank you. Okay. Thank you. Good morning, Dr. Walker, and magandang hapon for Filipino audience. As chairperson of the Cooperative Health Management Federation, the only HMO in the Philippines that is owned and operated by cooperatives, this is an honor to share with you our experience. First, the lessons that we learned during this pandemic is that healthcare is essential. Number two, technological innovation, particularly digital transformation, is the way forward. This technology-driven platform readily makes available a range of real-time services, healthcare services, at the comfort and safety of people's homes and offices. Well, we currently don't have our own technology platform for telemedicine. We have since partnered with a local telemedicine service provider in delivering value-added service to at least 15,000 of our co-op members at no cost, free, passed on to them. Our long-term goal is to have our own technology platform, which fortunately is no longer a matter of if, but only of when. And we would like to see it rolled out by May 2021. What are the challenges of promoting telemedicine in the Philippines? And in our case, in the co-op sector. Despite the advantages and benefits of promoting telemedicine in the country, particularly in our sector, it does not come without difficulties and hurdles. Let me share with you some of the key challenges in promoting telemedicine in the Philippines through the cooperative sector. First is the acceptance of our members, by our members. Initial exploratory studies showed that our members have a wrong perception that only physical consultations is the way to go because doctors can conduct physical examinations in support of more accurate diagnosis. Many of those interviewed also prefer face-to-face consultation because for them, these are far easier, more accessible, and hassle-free. For some, especially in times of emergency, driving oneself to the hospital ER might be a better and easier choice than typing answers over your smartphone. Second, we have the issue of risks of misdiagnosis and even medical malpractice due to the challenges when examining patients via digital health platforms. This creates an unnecessary fear for potential users. The third challenge that we face is educating patients and healthcare providers. More importantly, patients as end users must be educated on how to maximize the telemedicine platform in getting the proper healthcare at a cost-effective way and to boost the general public's awareness and acceptance of this technology-based service. Another challenge, the fourth one, is infrastructure. Quality of consultation is dependent on the quality of infrastructure, or telecom infrastructure in particular, which in our case is connectivity. While our intent is to reach the underserved sector of society, connecting with them is one of the biggest challenges in promoting and sustaining telemedicine. In the case of One Coop Health, our telemedicine services run through internet-reliant web and mobile applications. And last challenge or hurdle is data privacy. Many of our potential telemedicine users become hesitant to avail of these services because of their perceived vulnerabilities to cybercrimes such as hacking, identity theft, and others. We recognize the gravity of these challenges, but we at One Coop Health believe of the benefits of telemedicine, which far outweigh the disadvantages. Taking into consideration the pandemic, and we feel that telemedicine is the best risk management tool available for our Coop Health. Education will be the key in promoting acceptance and building trust in the platform. We have faith that the recent developments in infrastructure, policy reforms on the part of the government, those in the power sector and telecommunication sectors changes and reforms will catalyze the advancement of telemedicine in the country. Telemedicine is indeed the way forward for healthcare services in the country. It is another step closer, if not a quantum leap, toward realizing our collective aspirations for a universal health coverage. Maraming salamat. Thank you, everyone.
Thank you very much, General Llanto. That was very interesting, particularly the portion and challenges, which I'm pretty sure will also be echoed in succeeding discussions or presentations. Okay, now we go to our third panelist. Shine, please. We now call on Ms. Alfie Paulino. And we actually have two questions for Ms. Alfie. The first one, could you please cite an actual initiative in telemedicine where partnership between government and the private sector was successful in its effective implementation? And a follow-up to that is, what are the key factors that led to its success? So, Ms. Alfie, please.
Okay, good afternoon, everyone. Thank you for this invitation. So, prior to answering those questions, let me just introduce to you our company. So, there. So next slide, please. So Global Telehealth is one of the companies under 0917 Ventures under the Ayala Group of Company. So 0917 is one of the biggest incubation company handled by the Ayala Group of Companies. Back in 2015, prior to 2015, Ayala thought of venturing into health business. So there goes about AC Health, A Generica, Family Doc, etc. But they wanted to bring in a different kind of health service where it would be a service that would be directed to an individual. So primarily our market back then are those that are in the far-flung areas because we've identified three main pain points, which is accessibility, affordability, and time. So next slide, please. So we started in 2015. Back then, we were the first telemedicine company here in the Philippines. To date, we would say that we are the largest telehealth company because we've evolved from delivering teleconsultation to video consultation. Next slide, please. So our company name is Global Telehealth Incorporated. Our service name is Consulta MD. So by the name itself, it connotes availability of doctors 24 hours a day, 7 days a week. When we were starting, it was really a struggle to penetrate the market simply because people would say, I have HMO, clinics are there, hospitals are available. So it was really a struggle for us to penetrate. But fortunately, we were able to work closely with DOH. With the goodness of Director Eduardo Hanairo of Region 4A, we were able to do a project with Calabarzon, which I will be explaining further later on. So basically, what are the features and benefit of Consulta MD? We are a 24/7 telehealth company wherein we house our own doctors in our own contact center inside Globe Mandaluyong. We always tell our subscribers we're not here to replace face-to-face consultation as we recognize the limitations of doing teleconsultation. What we provide you is primary mental health care, which is an answer or to augment the immediate need to have an access to a doctor. So you don't have to be sick to call us. So we always say prevention is the best cure. So at the onset of a symptom, you can always call us. Any questions about general health information, maintenance drug, anything, you can always call us. Now, from 2015, we evolved the service from tele to video consultation. So we launched our own Consulta MD app. Consulta MD app is capable of creating individual electronic medical record, and included in the functionalities are e-prescription, e-laboratory request, e-referral, e-medcert, and even e-scheduler. So through the introduction earlier, I handled both government, LGUs, and enterprise account. So there are different implementation of telemedicine practice in this industries. So next slide, please. In our service, commercially, we're selling it. Imagine investing 2 pesos a day for your health. You'll have unlimited access to a doctor 24/7, plus 1 free video consultation per month. Other than that is that you have your own electronic medical record where you can keep track of your own health progress. You don't need to remember when was the last consultation, prescription, etc., because everything is stored there. So, as we mentioned earlier, with the goodness of Director Hanairo, we were able to roll out a teleconsultation project in the Calabarzon area in 80 identified GIDA areas. So, we identified 80 GIDA areas. The manpower required was only a barangay health worker, a nurse, or a midwife. We all know that on barangay health center settings, you'll be fortunate enough to have a nurse on site. Usually it's the midwife or the barangay health center. The time frame, it was from January 2020 until December of 2020. And it's for a 1-year subscription. Next slide, please. So what are the 3 main pain points that we would like to address? As mentioned, go back to the previous slide, please. So as mentioned, it's doctor access, affordability, time, and efficiency. For doctor access, not only that government is having a hard time deploying doctors to the far-flung areas, but there is a significant shortage of doctors here in the Philippines. Immediate access to the doctor would require the patient to travel hours before they would be able to reach the the most the nearest hospital or health facility. And of course, continuous care. So if they have to travel that far, 2 hours, 3 hours every time, it would entail cost and time for them. So usually there's no more follow-up after the initial consultation and the quality of service. In terms of affordability, how much would it cost to consult with a private doctor in your setting? Not only that, do you always have that money? Does everybody has the funds to do consultation as needed? And of course, to address issues of unnecessary trips to the hospital. So this is one way of declogging the hospitals. And then time and efficiency. Of course, right now, back then, the record taking is very manual, so they write. But with the electronic medical record we have, you can always extract those reports and provide it as deemed needed. So since it's also capable of doing e-scheduling, there would be an efficient referral system. So from the primary care that we provide in the Barangay Health Center, if there's a need to do laboratory or referral to a specialist, we could do it via the e-system. And then, of course, it lessens the foot traffic in the different health facilities. Now with COVID, not before we would want to address these concerns in the far-flung areas. But right now with the pandemic, everybody has that fear of exposing themselves in the different health facilities. Next slide, please. So these are some of the pictures taken during that activity, that project. Next slide, please. So program results overview. So what are the pain points that we have encountered? Number one, of course, is the acceptance of the new practice. So these people are those that are living in the far-flung areas. Not all of them are exposed in using Android phones. And another thing is that teleconsultation has not been part of our culture. Filipinos usually at the onset of would ask somebody else, what did you take to relieve your headache? So if the other person would say it's Alaxan, you'll go to the nearest pharmacy and buy Alaxan for it. So number one struggle was the acceptance of the practice and the ease of using the practice. And then other complaints, of course, since it's digital age, everything is connected with signal. Good thing that we are part of the Globe company, so we are able to address that. Capability is the readiness of the handlers. Of course, we have to do intensive training of the handlers, processes, what are the things that needs to be done, how to educate not only them, but the patients as well, and information dissemination. So since even if you put up big tarpaulins, give out flyers, not everybody would easily understand it. And of course, technical problems, as mentioned, there are gadgets that is included in that project. So the ease of using those gadgets, they have to adjust. And then, of course, proper training. Next slide, please. So after the project has concluded, we have identified our success points. Next slide, please. So previous slide, please. So what are the successes? Of course, the three main pain points that we have identified from the start, we believe that we are able to address that. So addressing accessibility, affordability, and time. Addressing accessibility because they don't need to travel. Doctor is already available virtually in their barangay health center. Affordability, of course, ease of doing consultation in their barangay health center without worrying about paying for that consultation. And of course, time. As mentioned, these are people from the far-flung area, so it saved them time and that this onset of the symptom is immediately addressed. Of course, connection solution, internet data, since as mentioned, we're under GLOBE, you're able to address that. And BPA compliance. So of course, this is part of the things that we've closely studied for us to be able to roll out the electronic medical record and the exchange of information. And then proper education and training, because we really took time to go to those places to train the nurses, the barangay health centers. Other than that, in between the project time, we do manual call out on the phones that was deployed to them just to check if there are problems, they have difficulties. And lastly, the EMR feature. So since we are able to gather data that is needed for them, with those reports, they can come up with a targeted solution per barangay. Because what we've learned is that for every barangay, let's say barangay A has more hypertension cases and barangay B has more upper respiratory tract cases. So at least programs that will be built by the barangay themselves or the local government unit will be targeted based on those informations. Next slide, please. So other than that, because DOH Region 4A project is more of teleconsultation, we also offer this to LGUs. Actually, this is already in place in Kawayan, Isabela. We did a POC in Sorsogon. So if you see the gadget here, we're now capable of doing virtual clinic, virtual consultation through that gadget. So that gadget has some diagnostic tools attached to it, like 3-diode ECG, glucometer, BP, thermometer, and even spirometer. So all of those diagnostic tools, once you take those exams, immediately the results will be recorded in that tablet. And the result will simultaneously appear in the screen of our doctors, where you can immediately initiate a teleconsultation for the initial diagnosis and assessment. And during the height of pandemic, we're fortunate to be tapped by DOH to provide free teleconsultation in the whole of NCR. At the same time, OWA also reached out to us for mental health cases in the different quarantine areas. So our doctors were equipped by DOH or were trained by DOH to handle COVID-related cases during the height of pandemic. And other than that, as early as 2016-17, with the rise of mental health cases, all of our doctors were trained to handle primary mental health care. So again, we're not saying we're the complete answer, but at least we were able to build our own ecosystem, which is an end-to-end process already, from consultation down to referral, laboratory, e-prescription, everything is inside the app already. With our partnership with the other Ayala group of companies like Generica, we have Health Now, we have AC Health. So right now, we're still pushing and developing other solutions targeted for the different industries here in the Philippines. So there. So for any questions that you have, you can just chat those questions so we can address it during the panel session. Thank you.
Thank you very much, Ms. Alfie. And yes, I think I already saw a question for you, which we'll be asking you later. And yes, okay, finally, we have our last panelist. Shine, please. For Ms. Hufsa Munwar, who's our expert on telemedicine advocacy strategy. Ms. Hufsa, the question is, as a communications expert, what important factors should be included in developing effective strategies to increase awareness and uptake of telemedicine?
Great, thank you. So I think it was a lovely discussion so far. The points that I've kind of drafted down, they actually get summarized pretty well. So all the panelists, the discussion that we were having was more from a service provider perspective in terms of the policy that we are creating, in terms of the service that we are providing. I have been an advocate of the end user, in this case, the people who will be accepting this service, or who will be the end customers that we have here. And over the last 3 years, my work has been around understanding what are the main pain points that people have in terms of the acceptance of telemedicine, and then how do we translate it into the communication strategies that we have, because it's very important to have a very important, very well structured system, but it's also extremely important to communicate it to the audience in the right manner with the right mediums, so that they understand what benefits telemedicine provides for them. So I've summed it down into simple 4 points, and I think if these 4 points are taken care of, the communication strategy for telemedicine can be very, very strong as well. So could you move on to the next slide, please? Great, thank you. So my experience for telemedicine has not just been developing content for the Philippines, but also for Pakistan here as well. And I think this is the pattern that we see in these developing countries is very, very similar. And there are 4 main challenges that exist in the communication strategy that we have related to any digital health, to be honest, but we will specifically talk about telemedicine here. So the first is, of course, the lack of trust, lack of understanding of the system, the awareness as to what advantages it can bring for you, and why should you be adopting, or why should you be shifting to telemedicine, and then, of course, reliability. These sound very simple, but when it comes to creating messages and when it comes to even creating the product that we have, it's extremely important to incorporate these points in the strategy in order to make sure that the message that we are trying to get across um, is effective, and also the fact that our customers as an end user feel comfortable in shifting to telemedicine from the traditional services that they're currently used to, since many, many years. Could you move on to the next slide, please? Great. So when we talk about lack of trust, what are the main areas that we are talking about? One thing that we have seen, in my research over the last 4 years as well, is the fact that so a lot of new telemedicine companies are coming up. There are many previous existing healthcare providers that are now shifting to digital health, but there are many new service providers that came up. And one of the reasons, that there were a lot of new companies coming up. One of the things that actually resulted in this was the fact that people started doubting the system. They were not very sure of whether they could trust the system that was giving them these messages. Why? Primarily, one reason could be that there was inconsistency of messages. Telemedicine is a very new concept, so a lot of marketers and a lot of communication experts we're also testing out very, very different messages in order to be sure what resonates with the audience. So of course that's one thing that really impacted the trust that as an end user can have on the party that's talking about telemedicine. Of course, change is something that we are not always very comfortable with. So shifting from a system that they're very comfortable with to a digital system was also something that kind of created that lack of trust in the system. And whenever you have a disruptive technology coming up, this is a general pattern that is seen, across any industry. It doesn't have to be healthcare. In particular, this is how user behaves. Of course, it was challenging the existing ecosystem as well, and people are also very scared of technology. I have dealt with, very different people who were accepting telemedicine, and then I also dealt with some people who were very scared of technology. They were scared of downloading an app in their phone. They were scared about their data being lost. Or the fact that they were talking about their health concerns, which is something very personal to them, and then they were discussing it over a technology app. And now with all the scare that we have seen about WhatsApp and all the social media platforms that we even use, this was also one of the factors that creates lack of trust. And when you're thinking about it from a communications perspective, this is something that should be addressed very, very early on. Another thing that also exists generally is lack of awareness. So when I talk about awareness, I think it's very important for people to first see the advantages that it brings for them, to first see the acceptance of telemedicine across the globe, for them to be able to understand that this system is important and that they should be accepting it. Um, a lot of companies and a lot of organizations that are now stepping towards telemedicine, they tend to focus a lot on the call to action. Download the app, book a consultation. But it's also very important to go back and to address the awareness that's required to make people feel comfortable with the idea of telemedicine as well. Of course, it's a new concept in the healthcare space, so there's a lot of there's a lot of awareness work that needs to be done also from the doctor's front. How are you making the doctors feel comfortable that this is something that they should be adopting to? What are the factors that they are looking at? And of course, because this is something that's relatively new for the developing countries, there is lack of data, and people like to trust things where they can see data, where they can see a success rate. We were looking at some really great numbers that were presented by Consulta MD earlier. But this is something that has come up after years of working in this space. And I think COVID has kind of really helped telemedicine overall, where it was creating that awareness that you can consult with a doctor from the comfort of your home without having to visit hospitals. So that was limiting your exposure altogether. Another factor that's also very important when you're thinking about a communication strategy for telemedicine is that your message needs to be understood by the audience. There are many times that we, as healthcare professionals or marketing professionals in this case, create content, but that content has a lot of technical jargon. Something as simple as the word telemedicine. What does it mean? So I loved the fact that our first panelist broke it down, that this is telehealth, this is telemedicine. So it's very important for us to understand that an end user is not used to these terminologies that we have discussed and we have talked about over the years. So it's easy to first break it down into simple terms and then make sure that you're hitting the right spot. And then, of course, when you are talking about communication, when you're talking about digital health, digital communication mediums are a very important platform, and they play a very important role in this entire ecosystem. And that also comes with a lot of digital noise. So there are too many companies talking about it. There's too much information, sometimes not even relevant, that's there. And that also creates this feeling of confusion whether you should be going with a telemedicine company or not, whether this is something you can trust or not. So whenever you're thinking about your communication strategy, it's also very important to make sure that you're focusing on the awareness and you're focusing on the understanding of the end user, whether it's a housewife who cannot drive and who is comfortable speaking to a doctor online, whether you're addressing a person of old age, whether you're addressing an audience of somebody who's a teenager. It's very, very important to make sure that you dig down the understanding level of that individual and then structure your message accordingly. And then I think the 3 points combine to make the last point, which talks about reliability. So can you trust the system, whether it's reliable or not? So one of the things that currently we face as communication experts when we talk about telemedicine is that of course there are limited case studies and examples that are there. And when I talk about case studies, it's very important for us to see real life examples of things happening. I'll share a very interesting story with you so that you can share it with your audience as well. Here in Pakistan, we were working with lady health workers, and our lady health workers was actually using our telemedicine app in order to make sure that we were trying to diagnose COVID cases early on as well. And while this practice was going on in our country, we actually happened to meet a woman whose baby was very unwell. And in this process, we identified that the medication that the baby was taking was wrong, and we were able to resolve that issue instantly there and then. And this was a case study that helped us reach out to a lot of other women because they instantly thought, okay, this is something that's very, very relevant for me. Also, because of patient confidentiality, there's this risk of not being able to share enough information. There are language barriers that are existing that create, that gap that we have in the communication strategy overall. And at the end of the day, it's all about being very empathetic, understanding that healthcare is something that triggers the emotional needs of people. So the message needs to be structured accordingly. You cannot think of a communication strategy that's based on numbers, based on facts, but eliminate that human aspect in it. Because we tend to shift to these kind of systems only and only when we feel very vulnerable. So I think if we incorporate all of these 4 points in our communication strategy, this is a challenge that we have been facing in the past. But if we work on these 4 aspects, we will be able to have a very strong message for our audience altogether, and hopefully it will help us in the promotion of telemedicine overall. Thank you.
Thank you very much, Ms. Hupsa, for those very concise yet very important points. Oh, thank you very much. So we've heard all four panelists. Now, before we proceed to the open forum, I'd like to ask the indulgence of our participants if it's possible to stay a little bit longer, probably 4:20, 4:25, given the technical glitches. And of course, we were presented quite some amount of information. So we hope that you would stay until that time, since there's still some things that we would like to be discussed, especially in this open forum. Okay, as mentioned a while ago, questions will be sent via chat. So we do have some questions. We'll try to go to the first one. And again, we hope for your understanding if we could not, again, ask all questions since we are already on extension mode. The first question is actually from our former boss, Dr. Malagardis. And this question is directed to Dr. Marcelo. Dr. Malagardi says, thank you for this excellent overview that speaks for positioning the Philippines high on the champions of telemedicine. The question is, what are the main policy and operational challenges you face currently, and how do you foresee these to be dealt with? Salamat po. Dr. Portia, please.
Yes, thank you for that. Essentially, right now, way back in 2013, what we have is a National E-Health Steering Committee, and we have an e-health strategic plan. What is actually, what we don't, but in the whole vision of universal healthcare, we really want patients assigned to their clinician. And in a way, I think that is the way to go, actually. While the current available telemedicine services are there, it's still the same. So it reinforces the same system. Only those who can pay have access to telecare at this point. And in the end, what we are not strengthening the health system. Okay, so I think to reply to that, so the National E-Health Strategy actually says that we have to invest in standards, and definitely setting that infrastructure where disparate electronic information systems can actually communicate with each other, because it is based on standards, technology standards, communication standards, and even clinical standards, actually. So that's one aspect of it. While certainly Major General Lianto's comments about the fears of people, well, right now the law says is that a doctor-patient relationship is really established when you physically examine your patients. And while telemedicine can be actually done, it is best done as a follow-up strategy when you've actually established a doctor-patient relationship. So you can, while there are now technologies that you can hear the heart across, for instance, our RX box was actually pioneering in 2007. We can actually monitor the contraction of the uterus of our babies, of our mothers, to support maternal care. That has to be in the context of a doctor-patient relationship. And again, we emphasize that it is supposed to be as an adjunct, not really to replace that. So what is also missing really are the guidelines that our government or our professional societies are saying that this is that clinically face-to-face and telemedicine are actually equivalent, specifically in specific services. So hindi po automatic that just because the technology is there, everything can actually be done telemedicine wise. So what we need are that kind of documentation, because it needs to, telehealth practice has to protect also the doctors in their assessment of their patients. If you read the fine print of a lot of telemedicine providers now, it will say there's no doctor-patient relationship. So in a way, our patients, diba, are also not protected in that kind of relationship. So Hufsa was actually correct. The community has, the people has to be made more aware about what telehealth is and what are the responsibilities of the providers, the clinicians at the other end. If in fact the clinicians on the other end are really clinicians, because you don't see them, even if there's those are founded fears. That's why there also has to be a form of vetting of the clinicians that telemedicine service providers are saying that they are. What is working right now is if it's in a network, so that the doctors are actually vetted by the institutions they are in, and that it's in a more established relationship, so that the sharing of so for instance in the co-op system, telemedicine that you're talking about, I suppose there is a relationship within the co-op and the clinicians and the patients in that telehealth system. So in a nutshell, many things. Number one, policy. For standards and interoperability. Two, infrastructure. Three, the policies to guide the clinicians as well as the patients. And then number four, also engaging the community to be conscious or to be aware what telehealth is, and also to be conscious of what they should what they are entitled to, and how they are actually also protected, as the clinicians are also protected. Over. So that's a long answer to that.
Okay. Thank you very much, Dr. Portia. So allow me to jump some questions so that we could hear from our other panelists. And this question is directed to Miss Alfie from my colleague Jimmy Loro. The question for Consulta MD is the online diagnosis accepted by healthcare insurance providers, both private providers and PhilHealth, in supporting for further healthcare services, for example, hospital admittance? What are its limitations related to accessing health insurance services? For Ms. Alfie, please.
Okay. Hello. Can you hear me?
Yes, yes.
Okay. For that question, as what Dr. Marcelo has mentioned, there are no implementing rules and regulations for telemedicine and right now. But we're fortunate that being Globe, we would always want to be compliant with the government mandated rules and regulations. So we've been working closely with DOH regarding this. We're trying to follow if they already have that guidelines. Currently, what we try to adhere to the medical law practices accepted here in the Philippines. Number two, in terms of diagnosis of telemedicine, it's not a conclusive diagnosis that we are providing. It's an initial assessment, and I don't know if interpretation is the correct term. So, if it really warrants, the presenting symptom really warrants a face-to-face consultation, that's when we do referral. Now, in HMOs and other health facilities, recognizing the diagnosis that's done by teleconsultation. Number one, for HMO, I believe in their practice, you have to be accredited by an HMO for them to recognize any reimbursement or any endorsement coming from them. Currently, we're acting as an independent body, doing augmenting medical needs or medical requirements by our existing subscribers. So my answer may not be conclusive or direct, because as mentioned by Dr. Marcelo, there is no guidelines yet. But what we provide is initial diagnosis. It's not a conclusive diagnosis based on the presenting symptoms as mentioned by the patient. So there.
Okay. Thank you very much, Ms. Alfie. Actually, we still have a lot of questions. But again, begging your indulgence, some of these will just forward to them. Uh, Specifically for Dr. Portia, maybe we could discuss this in a separate venue or communication. But thank you very much for those questions. Well, as I mentioned, we're already over time, and we still have one more activity to do before we formally close this webinar. And that will be the Menti survey for getting your feedback regarding this webinar. So Shine, please. So it's a polling survey, and there are 3 ways to join. Basically, you could scan your QR code if you're using a mobile phone. You could go to menti.com and use the code 97472297 and go straight to the link, which actually the easiest if you're all on the laptop. So may I ask you, the participants, to please go to the link so we could start this polling survey for Menti. Shine already shared the link. Okay. So the first question is, based on the discussions and information shared, which among these factors contributed to the growth of telemedicine in the Philippines? The first is the establishment of a policy framework. There's infrastructure like internet, mobile phone connectivity. The ease and convenience of getting medical attention and COVID-19. So please answer. We already have 11. So COVID-19 is number 1. So, okay, we're still getting some responses, so that's very good. And so I think we stopped at 32 responses. Number 1 is COVID-19. Oh, we're still getting some more, but still it doesn't change. It's COVID-19, which is what contributed to the growth of telemedicine in the Philippines. A far second is the ease and convenience of getting medical attention, which is actually, hopefully, will pick up soon in the future. Okay, so we're still getting some votes. Okay, thank you. Still doesn't change. The next question, Shine, please. How will telemedicine develop in the Philippines in the next 5 years? Is it fast, moderate, slow, or zero growth? Okay, so we have already, oh. Moderate is still number 1, but fast is making a lot of ground quickly, so fast and quickly. We already have 40 responses, now 41. And it doesn't change. I think this is it. Okay, fast is coming. But still, it's moderate. Moderate is this is how telemedicine is seen to develop in the next 5 years, given right now the situation and the developments in our country. So thank you very much. The next question, Shine. What major concerns should be addressed to ensure the growth of telemedicine? More/better policies and programs, education and awareness of the public, investments in technology, investments in human capital. Okay. Out of 43 responses, number 1 is education and awareness. More and better policies and programs is coming in at second. And surprisingly, investments in human capital, there's only one. Okay, out of 45 responses. And finally, for the last question, this is actually an open answer for everybody. Since we would like to find out what other topics on telemedicine would you want to be included or more thoroughly discussed in future Tuesdays with MEFIN webinar offering. So this is an open answer. Just type whatever you feel we need to offer in terms of topics. Okay, there's IRR. Mental health is coming up. Okay, issues telemedicine companies face at the moment. It's very interesting. So we have now mental health too, very, very much applicable during these times. Possible issues, technologies issues. Again, mental health. Mental health. The government implementation, mental health again. Data privacy, mental health again. Hopefully, there will be online messaging aside from calls and videos. Maybe that's the future. Thank you very much. Community patient experience on telehealth, financing of telehealth in UHC, technology. Well, apparently mental health is a big issue. It's been coming up out of 28 responses. I think it accounted for at least 1/3. Okay, so we have 28 responses. So I think that's it. Okay, so, well, one more, but still, okay. Yeah. Okay. So thank you very much. For those who want to continue answering, please do. This feedback will be very important for us in improving our further webinars. So that's it, ladies and gentlemen. Thank you very much to you for taking part in our webinar. And thank you also, of course, to our panelists, Dr. Marcelo, General Llanto, Ms. Alfie, and Ms. Hufsa, for sharing their time and expertise with us. Okay. And again, we apologize if we went over time, but I think you would agree that the exchange of information is very, very interesting. And we hope that you would tune in again in the next Tuesdays with MEFIN webinar. Okay. So goodbye and stay safe, everybody, please. Thank you very much.